Okay.
Press the record. Thank you.
Yes. Is it already recorded, ma'am?
Yes.
Okay, thank you. So, um, before I begin, let me start with knowing our goals for this afternoon. Our really main goal, we only have two. First is we have to reorient ourselves, our knowledge in relation to the ECG. And for those who are, or for those who doesn't have yet experience in doing the ECG, well, it's time for us to learn the basics of ECG. In ECG, in today's afternoon's lecture, we'll be discussing about the rate, the rhythm, and of course, the most challenging part is knowing the basics of determining the axis. Okay, so first we have to discuss, we have to familiarize ourselves the parts of ECG. Actually, we have different phases of ECG, but we have to know the basic parts. So, so this is basically the body of our ECG machine, this one, and we also have the power cord. You all know about this one, the bulb or the tubes. Sometimes, actually, most of the what they call this one, uh, advanced ECG machine doesn't already have or do not already have these bulbs. They have these electrodes or the attachments. So, but for us here, I think we have these the bulbs or the tubes, and we also have the clips. Um, it is necessary for us to know the colors of these clips because we have to properly assign this color, whether you put it in right arm, left leg, right leg, or whichever part. And then this one, the leads connector, and we also have the wire, what you call this one, ground wire. We have different phases of ECG actually. For us here in our hospital, I think we have the brand of the Fukuda. We also have the what you call it, the Welch Allen, I think, and I think we only have the two brands. And we also have here the Skiller. Actually, the Skiller is one of the topmost manufacturer of ECG. Another another one, this one. Why I put here the portable monitor? Actually, for the rest of us, maybe we do not know that the portable monitor we have in a hospital actually have an ECG. If we look at the back of our patient's monitor, we have some sort of ECG papers on it. It is not 12 leads ECG actually. It is just the 3 leads ECG. So meaning a 3 leads ECG, it only reads the um, unipolar parts of the heart muscles, which means we have the lead AV, AVL, AVR, and AVL. And we also have here the brand of these ECG machines, GE. We have actually same as this machine, but different brand. We also have this type of ECG machine. Actually, most of the ECG machines nowadays are portable, if not all, but most of them. Okay, let's discuss the types of ECG. The most common is the 12 leads ECG machine, but I'll be discussing that one in the latter part of this discussion. maybe we're wondering what are the differences between the 5 leads ECG machine. We also have the 3 leads ECG machine and the 12 leads ECG machines. Those are the ECG machines that are somewhat giving us questions. Maybe what are the difference of those things? So the 5 leads ECG machine uses 5 electrodes: the right arm, right leg, left arm, left leg, and the chest. The chest, the 12 leads ECG are using the 6 leads, or the what they call the precordial leads, the V1, V2, V3 up to V6. Those are the precordial leads or the chest leads. But here in the 5 lead ECG machine, we're only using 5 leads, which again, the RA, RL, LA, LL, and one of the chest leads, which is commonly the brown one, red, yellow, green, brown. I think green, brown, 4, V4. We're using that one, it's color brown. We are not usually we are not using the clips around here in using the 5-lead ECG machine, but we're using instead the patch or the electrodes. The first, this is, as we all know, this is like an anatomical position in which the patient is facing towards us. So the first lead, which is the RA or the right arm, will be placed in the second intercostal space, right, and then the black one. This is should be arranged. I mean, should be in a proper position according to its color. So the second lead will be placed in the left second intercostal space, left, and then the green one, the third lead, will be placed in the 8th intercostal space. Admit all. So for those who just joined our Zoom lecture, welcome. So we are now discussing the types of ECG. We're now here. We're discussing now the 5 leads ECG machine. Excuse me. And then the fourth one is the red one will be placed in the left side, the 8th intercostal space also. And then the fifth one, the 5th lead, or the chest lead, will be placed in the right portion or in the 4th intercostal space, just near the sternum. Nakakaubo pala. Wait lang. Okay, next. So that is the 5 leads ECG machine. We're just using 5 leads instead of 12 leads. And then another type of ECG, as I mentioned earlier, we have the 3-lead ECG machine. It only uses 3 electrodes. We have the right arm, left arm, and the left leg. So again, the first lead will be placed in the second intercostal space, which is the white one. Actually, this is very crucial to remember. Admit all. Sorry. We have to remember we should not like interchange the location or the colors of our patches or our electrodes. So the white one should be placed in the second intercostal space, right. So that is basic, or you should have to memorize that one. If not, you will be having a not so what they call that one, correct analysis of your ECG. And then the second lead will be placed in the second intercostal space, the black one, right side, left side, I should say. And then the third one will be placed in the 8th intercostal space. This is the red one. So that is the 3 leads ECG machine. Surprisingly, Halter Monitor is also a type of ECG machine. Technically, the definition of our ECG is to monitor the electrical impulse or the electrical impulse of the heart in which the Holter monitor also is doing. So basically, Holter monitor is placed on our body usually for 24 hours, right? So this is how the Holter monitor looks like. It's like old ano tawag doon, iPod. So just that. So that is also a type of ECG machine actually. Also, the stress ECG machine, the stress, what we call this one, stress ECG machine, or the treadmill, also is a type of ECG machine. I already experienced this one when I was in Pakistan. So this is really like, they will really give you stress. It will make you really stressed, wherein it measures your, what do you call that one? If your body is reacting normally to the stress that the machine is giving. But we'll not be having further discussion about this one because we're not yet on the highlight of our discussion. Admit call. Next. Okay, this is the most crucial part now. Let's begin studying the basics, basic interpretation of ECG. So are you ready? So as you can see, we have the ECG strip or the ECG paper is measuring the voltage and the time. You see here the arrow. Wait, sorry. Let me just draw annotation. Draw. See here the voltage. You see it. It measures the voltage or the amplitude of the electrical impulse or the wave. So that is the voltage, and the and we also have the time. The most important thing is the time. It measures the duration or how fast is the electrical impulse goes. We have in ECG strip, we have what we call the small square and the big square. So what am I saying? What am I saying? In one, this is this is the big square. Sorry, I think it's getting, I think I need to mute someone here. So again, as I was saying, in the ECG paper, we have what we call the big square and the small square. What we have to remember is that in one big square, there are 5 small square inside it, okay? Whether you're measuring the voltage going up or going from left to right, which means you're measuring the time, it contains only 5 squares. Next thing we have to remember is that when measuring the voltage, one small square is equivalent to 0.1 here, 0.1 millivolts. Again, in measuring the voltage, meaning going upwards, usually we're measuring here the Qrs complex or the Qrs wave. In one small square is equivalent to 0.1 millivolts, meaning in one big square, there are equivalent to 0.5 millivolts when we speak of small, big square. That is for the voltage side. But when measuring the duration or the time, we're talking of seconds here. So in one small square, there is 0.04 seconds. 0.04 seconds. It is very important for us to remember this one. 0.04 seconds. And also, in one big square, there is a total of 0.2 seconds because 0.04 times 5 is equals to 0.2 seconds. So I think it's clear. So again, we have to memorize or really remember by heart the 0.04 seconds in one small square. Okay, let's now begin discuss. Okay, so here are the steps in Ecg interpretation. First, we have to determine the rhythm and the regularity. So in the latter part of my discussion, we'll be one by one discussing these things. And then next thing to do is calculate the rate. Then evaluate each wave. We have the P wave, QRS, ST segment, the PR interval, and all. So proceed na. Paano ba to? Ayaw niya mag-next. Okay, wait, there's... Mami, ayaw niya mag-next. Nagahang ako. Sorry, guys. So while waiting for my screen to move, so what else needs to discuss in this slide? So there you have it. Your internet connection is unstable. That's why it explains why I'm not moving. Okay. Okay, there you have it.
Okay now, sir.
Okay na, ma'am. Sorry, ha. So now let's discuss the waves. First, we have to be familiarized with the P wave. This is the P wave. Annotate, draw. So this is the P wave. Basically, this is the P wave, and that is the normal shape of the P wave. When it expands or it elevates, which means if it elevates, sorry, so the amplitude of this wave becomes stronger or higher, which becomes abnormal. So memorizing the normal amplitude of the P wave is very vital. So again, the P wave represents the atrial depolarization. What does atrial depolarization means? Atrial depolarization is the contraction of your atrium, in which in atrium there you have the pacemaker of the heart, in which what we call the I forgot. Yeah, there you have it. Locate then next wave is the QRS complex. This one. The QRS complex represents the ventricular depolarization. So the contraction of your ventricles. And then the next wave is the T wave, represents the ventricular depolarization. Of course, our muscles must have to rest also. So here, it represents the T wave. Okay, clear all the rays. Okay, next slide. It is also very important for us to identify. So this is an example of our ECG strip, or this is actually the result of an ECG. So basically this is, you can't see any abnormalities in it. This is actually normal. So as a nurse, we have to know which lead
Tingnan mo kung meron
represents
kang naririnig
the
ang
lateral view of the heart, which leads represents the septum or the frontal portion of our heart muscles, which leads are representing the lateral portion or the inferior part of our heart muscles. So I categorize every leads here according to color. I encircle, or I initial encircle. So the lead one, V5 and V6 represents the lateral or the gilid portion of our heart muscles. And then we have also here the lead 2, lead 3, and AVF representing the inferior or the bottom portion of our heart muscles. We also have the V1 and V2. Actually, V1 and V2 are the septum, and the V4 and V3 are the frontal portion of our heart muscle. But we usually categorize that one as the septum frontal portion. You notice that doctors might say that you have an infarction around the inferior portion of your heart. So when you say infarction, there might be like ST elevation. So possibly, if the doctor will say infarction of the lower portion or the bottom portion or inferior portion of your heart, definitely you're going to see, or you're going to look here in the lead 2, lead 3, and AVF, because this represents the inferior portion of your heart muscles. So that's it. So let's discuss the rhythm first. Rhythm. What is rhythm? There are just two things. It could be regular or irregular. So if the doctor will ask, what is the rhythm? It could be normal sinus rhythm. It could be sinus tachycardia or sinus bradycardia. So if the ECG result is normal sinus rhythm, it should be like this. So it should be like this, normal. The spacing of the QRS wave is normal. The P waves are upright. The PR interval. One thing more, you should know by heart these things. The PR interval, I should say this. I should have discussed one earlier. The PR interval is very crucial because it really signifies the blocks. Are you familiar with the bundle branch block? Yeah, the blocks. Right bundle branch block, left bundle branch block. So by knowing those things, you just have to familiarize with the PR interval, because if there is blocks, we have to look at the PR interval. It should be within 0.2 to 0.20 seconds, and it should be consistent in between QRS. So the PR interval should be 0.12. So 0.12 divided by 0.04, that's 3. So the PR interval should be not less than 3 small square, and should not more than up to 0.20. 0.20 is 1 small, 0.20, 5 small square. So in short, the PR interval should not be less than 3 square, 3 small square, and not more than 1 big square. So that is PR interval. Next, sinus tachycardia, from the word itself, tachycardia, meaning the patient is having a above 100 beats per minute. So the rate should be above 100. So that we can classify the patient having tachycardia. So this one represents, it is very obvious here. Later we'll be identifying, or we'll be discussing how to identify bradycardia and tachycardia and measuring the rate also. So we have here the sinus bradycardia. So, sir, what the hell are you talking about? How can you identify if it's tachycardia or bradycardia? So see this one, the distance of the QRS. This one is the QRS. So the distance of the QRS here in the sinus tachycardia is very near to each other. So that's why we can classify that one as sinus tachycardia. And on the flip note, here in the sinus bradycardia, the distance between between two QRS complex is very far. So example, paano ito mag-clear? Bakit may drawing na? Wait. Paano man ito erase? So, example of the rhythm. This one. What do you think is the rhythm of this example? So this one, so if we're talking about the rhythm, if the doctor will ask you first thing, what is the rhythm? So first you have to look at the QRS complex. So the QRS here, annotate. Okay. So this is the QRS. The distance of our QRS from each other. So these are the QRS. These are QRS. And yun. These are all our QRS. So yung mga QRS natin, these are QRS. Okay. Ayun nga rin. Na-erase. Again. So ito yung QRS natin. These are QRS. I forgot that this one is touchscreen. Touchscreen, no social touchscreen. My monitor is actually touchscreen. That's why when I touch it, it actually.
Yes. It's so sensitive.
Yes. So, wala ma'am, touchscreen pala to, social. Yan. So these are my QRS complex at QRS wave. Napaka-sensitive ng screen na to, ma'am. So the rhythm, actually the rhythm of this one is regular, meaning the distance of the QRS are all the same. So we can categorize this one as regular. Annotate, clear. So next. So what do you think is the rhythm of our next slide? This one. Shalimar. I can see your face here. What do you think is the rhythm of our next example? So Haira. Actually, this strip is irregular. So by seeing our QRS complex around here, our QRS complex is not even. The distance of our QRS are not even. See, for example, here, this is our QRS. This is actually the long lead 2. So the first two QRS, the distance is 1. 1, 2, 3, 4, 5, 6, 1, 3. We have here 3 big square between them, but seeing the next QRS complex or the next QRS wave, for instance here, the distance of our QRS complex is only 2 big squares. So that makes this one irregular. So here also 2 or less than 2. Here 2, here around 1. So this makes our rhythm irregular. Hindi pala ito naalis. Okay. Let's now discuss the rate. This is one of the challenging parts. So by just seeing the, for example, this one, how can you determine the heart rate? So the heart rate of this one, if I'm going to use the one big square, the method, what we call the big square method, this is around 1 to 150. The heart rate of this one is around 150 beats per minute if I'm going to use this big square method. So what is big square method? How can you easily identify the heart rate of the ECG result by just seeing or by just computing the small square and big square? So here how it is. So again, we have to identify the QRS complex or the QRS wave because that is the basis of our measurement. We have to measure from one QRS wave to the next QRS wave. So in this type of method, the large square method, you have to measure how many big square in between two QRS complex. So I repeat, you have to measure how many big square in between two QRS complex. So basically this is, we can use this one in a regular rate or regular rhythm. If the patient is having irregular rhythm, we cannot use definitely the large square and the small square method. So this is only useful in regular rhythm. So again, balik tayo dito. Draw. So this one is our QRS, first QRS, the second is QRS. Okay, if you notice, we only have one big square between them. So the rate is 300. This 300 is actually constant. Okay, constant. We have to remember in one big square there is 300 beats per minute. If there are two big square in between two QRS wave, the equivalent of that is 150 because as I've said, 300 is constant. So 300 divided by 1 meaning there is one big square in between our QRS complex. So that's why we divide it by 1. So 300 divided by 1 is equals to 300 beats per minute. And the next, if we have two big square in between two QRS complex, the result of that is 150 beats per minute. Okay, so for example, this one, this is QRS and this one the QRS also. There are two big square between them. So we have to divide 300 divided by 2 is equals 150 beats per minute. So that is the result. If there are three big square in between QRS, two QRS, this one are QRS and this QRS, there are three big square between them. So we have to divide 300 divided by 3. So that gives us 100 beats per minute. And so on. 300 divided by 4, meaning there are 4 big square in between 2 QRS complex. So meaning 300 divided by 4 is equals to 75 beats per minute. That is for the big square method or large square method. We have actually the small square method is more close to reality as compared to the big square method, because this one. So first thing also in the small square method, first is we have to identify again the QRS complex. So it is very crucial for us to identify which one is the QRS complex. We're only giving a normal QRS complex, but whenever, because there are patients who doesn't have QRS complex, it might be the patient is having some sort of abnormality. That's why they don't have QRS complex. So that's another thing. No, but this one we're talking about normal. So here in small square method, these are the QRS complex. So we have to count how many small square between them. So there are 1, 2, 3, 4, 5. So 1,500, again, this is constant. In small square method, the constant is 1,500. In big square method, there is 300 as constant. But here in small square method, we have to remember the 1,500. So 1,500 divided by how many small squares are there in between two QRS complex. So that gives you the result. So for instance, there are 5 small square in between 2 QRS complex. That gives us 300 beats per minute. And 1,000, if there are 10 small square, the 1,500 divided by 10 is equals to 150, and so on. So I think that's clear enough. So let's proceed. The stress now. Okay. So I mentioned about regular rhythm. Now we go to the measurement of irregular rhythm. As I've said, you cannot use the small square and the big square method if the rhythm is irregular. So what about if the result is irregular? We actually have that. My method pa din. We use the what we call the 6-second strip method. 6 second. In this method, 6-second strip, we have to use 30 big square, meaning so count 30 big square. Again, count. So I have underlined here. So from starting here to here, yes, I already counted this one. There are 30 big square in it. So in this 30 big square, you have to count how many QRS complex are there in between or within these 30 big squares. And then multiply it by 10. 10 is constant. 10 is constant again. So in this example, we have 1, 2, 3, 4, 5, 6. So 6 QRS complex times 10, that will give you 60 beats per minute. Okay? Why we call it 60? Why we call it 6-second strip? Because in 30 big square, it gives you 6-second strip. 6 seconds in duration. Your drawings. Okay, let's give example. This one, regular lang to. Okay. Okay, let's use the 6-second strip method in this example. Actually, this example is irregular. Why irregular? Look at this part. Look at this part around here. Oh. So, hindi siya, it's not here. The distance between QRS complex are not the same. See here, there are around 1.5 big square here and here around 3 big square in between them. So that will give us an irregular heart rhythm. So we can use here the 6-second strip method. Okay. So let's count how many, let's count 30 big square. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 5, 26, 27, 28, 29, 30. So up to here. So let's count how many QRS complex are there. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. So 15 times, so our formula is, we divide it by 10, right? So 15 times 10 will give us 150 beats per minute. So that's it. So we have 150 beats per minute in this result. 150 beats per minute. This one. Okay, next slide. Okay. Admit all. Diana. Okay. Let's now discuss the most challenging part of Ecg interpretation, which is axis. Okay. First thing, we have to be familiarized of the hexational system. What the hell is this hexational system? This is commonly known as Cabrera system. So hexational reference system looks like this one. I know that you're familiar of this, but you don't know that this is it, that this is the hexational system. This one is the hexational system. So commonly, okay, what, 0, 0 yan na, 0, here 180, here 90, positive 90, negative 90 around here. Okay, the upper portion of these diagram, I'll have to color it color green for negative. This one, the upper portion of this one is considered negative. Okay, negative. So yan, pataas, negative yan lahat. And around here, sa baba, ano yun? Parang may nag-join. Okay, going down are all considered positive. Okay, but normally it should be the other way around. No, usually going up is positive and going down should be negative. But in the hexational system, measuring the electrical axis should be this way. Okay, Joe. Okay, the normal axis should go around from negative here, negative 30. Thanks. Negative 30 degrees up to positive 120. So if your axis within negative 30 to 120 degrees, that should be considered as normal. That should be considered again as normal. If your axis is within negative 30 up to 90, negative 90, we will consider that one as left axis deviation. So wrong spelling, wrong deviation. Okay. So what is left axis deviation? So left axis deviation meaning the electrical impulse which is normally go into this part of the heart, which actually going this way. Dapat color, ibang color. Okay, the electrical impulse should go this part, meaning within the normal angle from negative 30 up to 120. So instead of going that way, the impulse is going into this angle, which is negative 30 up to negative 20. So we call it left axis deviation. Next thing, if the impulse is going this way from from positive 20 up to positive 180, we consider it as, we name it as right axis deviation. Spelling wrong, deviation. And then here, which is very rare, unrecognizable here, this one. Here, from 180 up to negative 90. So that is Fixation system. Okay. So how do we identify, or how do we measure the axis? Okay. For example, next slide, sorry. So how do we measure the axis? So here's the thing. So this is our Fixation reference system. So we put here 0, 0, parang iba yung kulay. Here 90, nyari. Hirap mo mag-draw. 180, 180, and then here negative 90. Sorry guys, ang hirap mag-drawing pala. Basta negative 90 yan sa taas. Okay, so this is our Fixation system. So in identifying the axis, we have only to look at the lead one and AVF. So where's the lead 1 and AVF? This one is our lead 1. Lead 1. So ito lead 1, which represents the what? The lateral portion of our heart muscles, right? Lead 1. And the AVF. AVF is the yeah. So AVF. So now that we identified where is the lead 1 and AVF, we now then measures the QRS complex. Again, go na naman tayo sa QRS complex. So that's why it is very important for us to familiarize the QRS complex. Okay, in this strip, the QRS complex of the lead 1 is, we have to count how many small square. We have to count the amplitude. So here, how many small square? From here, from the isoelectric line. When I say isoelectric line, this one, this is the isoelectric line per se. Yan yung isoelectric line. So from the isoelectric line here, we count how many Jenny Ranches, admit. Okay, how many small square? 1, 2, 3, 4, 5, 6, 7, 8. 8. So 8. So we draw here 2. So positive, no? So positive here. This is the positive one here. Diba? Positive dito lahat. All here positive yan. So let's draw here, how many yan? 8. 8 small squares. So 1, 2, 3, 4, 5, 6, 7, 8. So yun. So 8, because there are 8 small square in this QRS complex, measuring the amplitude, meaning going up from the isoelectric line. And now we take a look at the AVF. AVF. Ayan, this is the AVF. Okay. Our AVF is actually negative vector. Negative yung ano niya. It means the QRS complex is going down. So the impulse is negative. So saan dyan ang negative? Here is the negative. So how many small square going down? 1, 2. So 1, 2. Ang hirap pala. 1, 2. Ang hirap pala mag-draw. So 1, 2. Delete ko muna to. Clear erase. Okay. Galing ko na. 1, 2. Okay. So dito. So this is the end of our small square wherein we counted the lead 1, in which there are 8 small squares. So this is the end. And also we have in the AVF, we have 2 small squares. So ending here. Then now let's draw color blue. So here and here. Hindi straight. Wait. Undo. Draw. Ganyan lang. Yan, straight. So this is the end. This is the meeting point of our impulse. Parang hirap niya. Ayan. This is the meeting point. So if we are going to draw an arrow, draw. Starting from the starting at the center, if we're going to draw an arrow like this one, meeting this way, so that will give us at around what? 20, negative 20 angle, or negative 20 degrees. So the normal axis should be -30, -30 to positive 100, positive 120 degrees. So this should fall into a normal axis. Naintindihan niyo ba ako, guys? Bala na kayo, guys. Okay, so this will give us 120 degrees, in which the normal is, ano bang normal? -30 to positive 120 degrees. Yun ang normal. Normal is -30 to positive 20. But the result of our axis here is 20. Only, bakit to 120? 20 lang to. Sorry guys. 120 lang pala to. This, sorry, 120. This should only be 20 degrees pala. So, 20 degrees. So our axis is normal. Okay? Any question regarding this part? Please turn on your audio if you want to ask question regarding this axis determination. Okay, none so far. Very good. Next slide. 1 minute, 8 here. Okay. So we should supposedly be identifying the axis, but I think it's clear since no question. So let's proceed to another slide. Okay. This is the hexational system again. Kaya naman. The one I explained to you earlier is the manual measuring of the axis. Like we measure how many small square and identifying the AVF and the lead one. But here, this is the rule of thumb. In identifying the axis, this is like, again, we have to identify the lead one and the lead AVF. Just determine whether the amplitude of the QRS complex is positive or negative. So for instance, in lead one, if it is positive, if the lead one is positive and the AVF, the lead AVF is positive, so that will give us an axis of normal axis, which means from 0 to positive 90 degrees. And if the lead one is positive and the lead AVF is negative, that will give us a possible left axis deviation, meaning from 0 to negative 90 degrees. And if the lead one is negative and the lead AVF is positive, negative to positive, that will give us a right axis deviation. And on the other hand, which is very rare, if the lead one is negative and the lead AVF is negative, that will give us an extreme axis deviation. Yes. So that is the right axis deviation. If the QRS is dominantly negative in lead 1 and positive in lead AVF, then the axis is rightward, right axis deviation. So as we can see in the illustration below. So lead 1, negative, right? Negative siya. So lead 1 is negative, meaning the amplitude is going down and the AVF is going up, meaning positive. So that will give us a right axis deviation. Next is the okay. I need to discuss this one for us to really understand the axis. As what I've mentioned earlier, axis is like the flow of the electrical impulse. Supposedly, the impulse should go this way from the sinus node, which is the what they call this one, the pacemaker of the heart, or the SA node here, located in the right upper portion of our right atrium, should go to this one, to the AV node. And then the electrical impulse will go to the bundle branch, the left and the right bundle branch, and going to Purkinje fiber. So for those who just joined just now, sorry, but I think we're on the, we're about to finish. Sorry. Sorry, here. So again, the electrical impulse should follow this pathway. So what happened in the axis, for example, if left axis deviation, meaning the angle is from -30 up to -90. So the, like this, and again, mag-draw ako nito. So this one are, okay. If it's left axis deviation, it looks this way, left axis deviation or LAD. So left axis deviation. So instead of going, the impulse should go from the SA node going to the left atrium. So this way. So the impulses should go this way, left atrium. But what happened in the left axis deviation, the electrical impulse is going this way of this chamber. Okay, the electrical impulse is going this way. So that is what we considered as left axis deviation. And if it is right axis deviation, more of the impulse is going here in the right atrium. Okay? So that's why, that explains why our left left ventricle, that's why our left ventricle is the most muscular part of our heart muscles, because most of the electrical impulse or energy is given to this septum, or this area of our heart muscle here. Kapag ka naman the impulse is going this way, which I don't know if it's possible, that is considered extreme axis deviation. So that's I think I already had mentioned this one earlier. The lateral portion of our heart muscles, it can be found in the lead 1, AVL, and V3 and V5 and V6, sorry. And the septum are the from V1 to V4. And the inferior, or the bottom portion of our heart muscle, should be in lead 2, lead 3, and AVF. Okay, let me just repeat. Hindi tapos na yun. Ay, sorry. Wala pa, sorry. Ano ba yan? Okay, I need to discuss this one because I think that this would be the basis of your return demonstration for some of you here. So the Ecg placement. these are the precordial leads or the limb leads or the chest leads per se. We have the V1, which is should be located in the fourth intercostal space, right mid-clavicular line. This is the V1. And the V2, which is the yellow one, should be located just on the, ito pala nakasulat. Fourth intercostal space to the left of the sternum, mid-clavicular line. And the V3 around here, this one, the green one, the color of the chest leads are universal. So you have to remember also. So the green one, the V3, directly between the leads V2 and V4, and V4 should be placed in the fifth intercostal space at mid-clavicular line. And then V5, level with V4 at left anterior axillary line. And lastly is the V6 at the level of V5 at left mid-axillary line, directly under the midpoint of the armpit. And the limb leads, we have the white, black, red, and green and red, sorry. So the white one should be placed on the right arm. The black one should be on the left arm. The green one on the right foot. And the red one should be placed on the left foot. Just to remember, just for you, you have to remember that we should have to avoid the bony parts of our body for us to have a proper conduction of ECG. Lastly, sorry, I need to discuss this one because this would be the basis of your. We're done with the ECG interpretation, the basics, and let me just discuss this one. For those who will have the return demonstration, we have to remember first we have to wash our hands first. Wash our hands, then check the doctor's order, don your PPEs, then prepare equipment, the ECG machine, the disposable shaving equipment, alcohol wipes. Then you have to introduce yourself and confirm the patient. Then explain the procedure, remove the clothing from waist up to the shoulder, or if the patient has any metallic object, you have to remove that one. Give patient, of course, privacy. Put the gown on. Then place the patient in supine position, of course. Then instruct the patient to remove any metallic object. Identify the electrode. Mamich, ngayon lang si Mamich. Mamich, we're about to finish. Identify the electrode position and clean the skin using alcohol pads and using 2x2 gauze pad. Then, of course, I already discussed this one, the placement. And then attach the lead wires to the limb electrodes following the correct arrangement or correct sequence. And then ensure the patient to relax and be still. Press the record button and obtain tracing. And then disconnect the leads. And then after doing the procedure, clean the skin by wiping it with gel. Ensure the patient is comfortable, of course. Then lastly, wash your hands and document the care you had given. Thank you, Ma'am Mimi.
Okay, thank you. Any questions from the participants?
I think most of your question will be here. Any question regarding ECG tracing, basics on identifying the rate, rhythm, or axis?
You can open now your video as well as
all open your video for
your microphone.
Yeah,
Kindly raise
group,
your kindly raise
picture,
your hand
group picture.
in the chat box if you have any questions.
Paano naman ito palakihin, Ma'am Mimi? Ay, ganito pala. They're all shy. I don't know if they understand. Actually, this topic is really difficult, no? Especially the axis. I'm just praying that everyone, if you not all absorbed it, but in some way you gain some knowledge.
Miss Angela Tungol has a comment there, 150. Anything that you would like to raise? Questions?
Ano yung 150,
Thank you,
ma'am?
Camila Chita, for yes, we have recorded and we can produce a hard copy for that. Anyone? Any suggestion?
Saan man ang mga comments?
Okay.
Hindi ko kita sa mga comments.
The
Anyway,
chat
can
box,
you open
sir.
your cameras,
The one
please, so that we'll group picture?
Sir, kindly stop sharing the screen so that
Stop
we
na
can
tayo?
have the videos of the.
Okay, stop share na tayo, ma'am. Okay.
And then may I ask everyone to share their